right? All right, go ahead, Gold. Talk to us. Are you following me yet? Hold on. Are you? Let me see if you are following me.
Yeah, I'm following you.
I'm following you. All right, go ahead.
Okay, I want
Okay,
to
I
ask,
want to
like,
ask,
when
like,
should we
when
start calculating our pregnancy?
our pregnancy? Obviously, you are just coming. We've talked about all this. All right. If you know your ovulation, your ovulation, if you know it, you can start counting your pregnancy um, from that day, because ovulation occurs just one day and the egg is only available for fertilization from that day. So if fertilization takes place that day, the next day will be day one. Then from that time to 6 to 10 days, implantation should be occurring. So two windows which I've taught the people who have been here that you must know very well. Two windows is your fertile window and your implantation window. If you know it, your problems are solved. Is that okay?
Okay, sir.
Okay, sir. You're welcome.
Uh, Please, I want to ask
Go
my
ahead.
second question, if I'm permitted.
Keep asking until the next person comes up. Now God do for you.
I'm having this kind of something like a noise, like on my stomach. It's not a noise, but it used to do purr, purr, purr. I don't know what that noise is for.
You sure it's not your village people? Are you sure it's not your village people?
No.
All right. People ask that question. People ask these questions. So when did you start noticing your stomach is making noise like they are scratching burnt food from pots? When did you notice it?
um when it was from this month, because I tested positive last month.
So, all right. So first of all, um, the normal thing that happens to us is bowel movement. Some of us will hear that sound because of our bowel movement. It does not mean that we have any problem. You're not vomiting, you're not purging, no stomach pain. You don't need to worry about it. You understand? But I also know that
Okay.
pregnant women are very fearful people. I know that. So it's part of what is happening to you. so, so don't worry. Nothing is wrong. Nothing is wrong with you. Sometimes there are certain food you eat that will require increase your bowel movement to get the job done. Sometimes it's maybe the basically food is that type of food. For example, if I take milk, I don't take. I'm intolerant to milk. Most black people are anyway. Even though we are forcing ourselves to take milk, it is not our genetic design. I'm not talking about breast milk. I'm talking about those milk they sell in the market. It is not our genetic design to digest it. That's why some people, when they take milk, whether in their tea or whatever, they start either having stomach upset. Some will have this kind of noise, pro, pro, pro. like you mentioned, right? And stuff like that. So it's basically what you have ingested. But don't worry, you are not sick. Is that okay?
Okay, sir. So one more
Uh,
question.
should keep asking until the next person is ready.
I'm I used to have hotness of stomach sometimes. My stomach could be hot.
Since when?
2 days night to be hot and it will stop.
Mm-hmm. No, don't worry. It's not a problem. 2 days now. Don't worry. You're not even on.
Okay.
You're not the only person in that boat. Gifts, only gold. Are you pregnant too? Right. so, I don't think it's a problem.
Mm-hmm.
Right. How many weeks gone are you? I see you.
And I don't know.
When was your last menstruation?
On 8th of last month.
That was. And when did you test positive?
On 26th of last month.
Okay. Don't worry. Nothing is wrong with you. Just make sure you do all the right things we have said, and you will be fine. Is that okay?
All right. Thank you, sir.
You're welcome.
I really appreciate it. Thank you.
You're welcome. Of course, gas can cause it. It's not the type of food you eat that will cause gas formation.
I used to eat fufu.
I know. I know. Long as you are in Africa, I trust my African people. I trust you guys. When I need to carry last. What else would you even eat in Africa? Is it not fufu? That's our food now. So nobody should take your fufu away from you. Is that okay? All right. So nobody else is asking questions. It's time for us to go. What is causing me hotness of belly? I don't know. I don't know. Go and see your doctor. Right? But more likely is hormonal changes because na only woman now they complain that thing. Is that Hondo? I see Hondo. Hondo, are you here? Good to see you. All right. I removed my implant since. What do you mean that it's not working? Gifts. What do you mean that you're trying to conceive but it's not working? You need to give us clarity. More likely is information you need. If I ask you now, you will tell me how you have spent a lot of money going from place to place. What you need is information. What do you mean? Explain. I removed my implants in September. I'm not yet able to conceive. Abba now, September. Give your body time. Kept I don't dey vex so I'll carry your Rimo cord for this woman. Is it Kebish, calm down. Why are you in a hurry? Your body needs time. Well, okay, you were not here when I was talking about contraceptives. I talked about it. Your body needs time. Don't worry. Nothing is wrong with you. Don't go and start. blaming your village people that they tie your womb. Nobody tie your womb. Let your body recalibrate. You'll be fine. Is that okay? You need to, sincere, please see your doctor so that they can find out why. It can be anything. Hello, Hondo. Good to see you. E- Queen, Queen Betty, what kind of question is that? What kind of question is that? Infection is not normal at all for any even when you are not pregnant. Needless to say, when you are in third trimester. I don't understand the question. So that is not a valid question. Who is there? Is that Hondo? Hondo, how are you?
Oh, hi. Yeah,
Good to see
I'm doing
you. You
okay.
sound like one of my friends in the UK. Are you in UK?
Yeah,
I saw when they talk.
right. Can I ask you a question, please?
Go ahead.
Yeah. Is it possible that when you do IVF, yeah, and when they do the transfer, they ask you to wait for about, let's say, about 10 days or so, come back in for a blood test to confirm, and maybe when you are home and you're feeling anxious and it's really, really difficult during the waiting period. So you are tempted to
Yeah.
check. You don't you, you don't have any
Oh, you go
symptoms
and
at
check
all.
before the time.
No, you use the urine. You use the urine to check, and but you don't have any symptoms at all, and you use the urine to test, but you still can't see anything. Is it possible that it's too early, or it is not
Why
positive, or
are you like this?
I
Hondo,
don't know?
why are you like this? You were here a few weeks ago. I explained this thing. I said the pregnancy hormone appears first in the blood before in the urine. So doing urine test is a waste of time.
Okay.
Do you understand?
Wow.
So it's going to appear in the blood first. It's when the levels in the blood has gone beyond what the body should have. That's when the kidneys begin to clear it out. And that is when you can test it in the urine. That's why
Oh,
blood
okay.
tests
I
is
think
always
the day
advisable.
that you were doing that, probably I missed it. That's the reason why I'm asking you again. I'm sorry. I didn't know you talked about it before.
Now you know. So
Yeah.
calm down. Be patient.
All right.
And by the way, I hope you know this your anxiousness, anxiety, fear, worry, all the mental stress. I hope you know it has its own negative effects. I hope you
Yeah,
know.
last time you talked about it, yeah, I was hesitant about
So
it.
when are you going to calm down?
Actually, now, now that I've
Good.
spoken to you, it's giving me a little bit
Calm
of relief.
down. Calm down. Calm down. Here in Nigeria, we say cool your temper. Cool your temper. Cool down. Is that
No,
okay?
but yeah, but so does it mean that within that 10 days, I mean, are you supposed to feel something at all?
You may not feel anything
Okay,
because all the earlier events of pregnancy would happen without you knowing that it is happening.
okay,
You understand? And the moment you test positive, also go home and calm down. Don't allow anxiousness, excitement cause you to abeg. So we're expecting it to be positive. When it's
okay,
positive, we'll give you the remaining part of the gist. But for now, fingers crossed. Keep that your urine test kit one place. It's not needed.
Okay. Thank you very much.
All right. You're
Thank you.
welcome. All right. Before Loisa, calm down. Hold on. Before you, Nice asked a question. I want to take these guys in the comment section. Nice, I said, I'm 14 weeks now, but no bump showing. Is everything okay? Do you have any reason why everything should not be okay? Did you go for ultrasound? Did you go for ultrasound test? Scan, sorry. Did you? Let me know. So long as you've gone for ultrasound scan, the baby is viable, growing well, why are you worried? So let me know. Acid injection can cause illness. Okay. Yep. I use it for now. Okay. You should not be worried. Husna moms. Yes, feeling tired and breast sore, these are part of things you should feel. For some people anyway, not everybody. Give said ovulations. I'm 8 months pregnant. Please, how many weeks? What kind of question is this? Gloria, be careful. Gloria, be careful. Which kind of question is that? If 4 weeks make 1 month, how many weeks is in 8 months? The simple calculation. I'm 2 days late. Could it be pregnancy? Fingers crossed. Fingers what? Crossed. Wait. Let's see. Doctor, my wrist hurts so bad. Hey, I'm sorry, Ogechi. What happened? Did you strike it against the wall? What did you do? Sorry about that. So please, I need what? Okay, I keep having right. Is it once every month or is it after ovulation? Possibly is possibly. Well, have you gone to your doctor? Please check with your doctor. Let's see what's going on there. Maybe something is there that we don't know yet. It's Liz. Don't worry about that information. Just make sure you go for your ultrasound scan. You just woke up and you couldn't lift anything again. Sorry about that. Go see your doctor. Maybe you need to see a physiotherapist. What can you do to conceive? Just keep listening to me. You will have testimony like other people. Yes, okay, Chief. For some people, they have this kind of complaint. So your case is not in isolation. Cynthia said nothing is there. I'm not sure what you are referring to. All right, Loisa, let's talk to you.
Good evening, boss. We
Hi,
don't we
good
don't want you to
evening.
leave. We want you to stay with us. So I'll ask
I
questions
know,
you're okay.
That's why questions are just pouring in. I know.
Doc, please, how do we manage mood swings in pregnancy?
Manage what?
Mood swings. Yeah, again,
Mood
things are
swings.
so in trouble. Yeah.
Mood swings.
Yeah, what do you do when you realize what your attitude is as a result of that, but it's because of your condition, yet you have no control over it.
And it depends now. Is it the aggressive mood swing or the lovey-dovey mood swing? Which one?
The least you get angry, irritable.
You are of course, that is because it's just hormonal changes that's causing it. Even when you're not pregnant, your cycle alone self, you have several mood swing in a month. So how do you measure it? How do you manage it? But if you are always angry, go and look for a punching bag,
Okay,
because
dog.
most
The
of
second
you
one is it.
most of you would vent. All right, go ahead. Go ahead.
It's a contribution.
Go ahead now.
I want to tell our lovely mothers
Please
there
go
that
ahead.
it's a blessing. It's a blessing to conceive. And
Mm-hmm.
also in everything, we've got to give thanks to God. Like you taught us earlier on, you made us know that there are numerous reasons as to why miscarriages do happen. And one of the major reasons happen to be abnormal chromosomes. So in
Yeah.
circumstances where you are a victim of miscarriage, be it once or twice, shouldn't create so much anxiety in you. Also, you added that pregnant women are the most anxious ones. So I want to entreat and encourage our mothers out there that they should trust in the God they serve. The Bible tells us that in everything we should give thanks to God. Proverbs 5:7. So we should be anxious for nothing. So the fact that we had this very miscarriage doesn't mean that it's going to happen again. Probably it happened for our own good. What if that child happened to have abnormal baby? Are we ready to carry that baby? No. So when miscarriages happen, let's not let that weigh us down, because anxiety affects us, and not only that, and affects the fetus, like taught us. Okay, so moments when we get anxious, just say to
Yeah.
baby that baby, you are going to be fine. Keep saying positive things to yourself. Keep being positive. That is how I strongly believe that your
Yeah.
pregnancy can go to term. Thank you, doc.
Yeah. Thank you very much. Thank you very much. That is a very good one, good encouragement. Because even when you are worried, did you change anything? Rather, you are destroying. Your worry does not change anything; it destroys. So calm down. Cease the fear. I know that it's not an isolated case. Most pregnant women are always anxious. They fear everything and anything, right? Maybe they see wall gecko in their room. They're already afraid, right? So they just have a positive mindset. But I'm more interested. Now, I bless God for all of you who are already pregnant. God bless you. Your baby will come through. Your baby will come healthy and you will celebrate. I thank God for you. 7 people in the FYP agree to. But I thank God for you. But for those who are still trying to conceive, remember, it is not magic. All you need is good evening, triple kids. All you need is to have the right information and a positive mindset. You see the other day, was it? I can't remember. That was Tuesday, yesterday. The lady that spoke with her husband. I know she's not here. She's not here, right? Now she has already made up her mind and already on her way to the fertility clinic for IVF. Then bam, she was already pregnant. I tell you, if you just get information and do the things we tell you to do, nobody is asking you to go and buy white fowl and sacrifice it somewhere No, you don't need all that. All you need is the right information. And God has blessed us that we have the information to give you for free, right? For free. Don't waste it. So for some of you, while you are yet contemplating IVF and you are doing what we say you should do, you'll be shocked that you may not even need the IVF anymore. And for those who are told already that it's necessary for you to do IVF, please go ahead. Because I don't want you to waste your time. You don't want to be 60 years old and you don't have a baby or someone who will take care of you. Right? Somebody needs to take care of you. I know in Europe and America they have a place where they dump their old people. That is not the African way. Africa live a communal life. Everybody take care of everybody. But unfortunately, nowadays it's your kids that will take care of you. Just imagine you have none. What happens to you? You're going to depend on your brother who is taking care of his own family, or your sister's kids who is not obliged to you. Be smart. If you need the IVF, go now. Today is the time to make up your mind. But I guarantee you, if all things being equal and you're doing the things we say you should do, I guarantee you that the pregnancy will come unannounced. I'm not saying it for saying sake. I'm telling you because these are the things that we've gotten result out of. Right? Christy Label, I was asking after you 1 hour ago. Good to see you. How are you today? Good to see you. You're welcome. And by the way, thank you, Christy Label, for the wonderful gift. I thank you very much. Thank you. It is people like you that encourage the things we do. We don't do this for money, but when people appreciate you, we are re-energized to always want to come and dole out more knowledge, right? But it's okay. Thank you very much. God bless you. Who is asking this question? Bello Abiodun. I don't know what you are saying. I don't know. Please rephrase. So please take the information seriously. Tomorrow we're going to continue from here. Remember, we are done with first trimester pregnancy. And I tell you, you don't want to do anything wrong that will affect your baby. Otherwise, you cry premium tears. Either the pregnancy will fail or you have an abnormality that you have to live with all your life. And I don't want this to happen with you. You cannot spend all your time looking for a baby only to have a deformed one. Please, take this thing seriously. God will help. Dr. Pat is here. Good evening, man. Hello, Bello Abiodun.
Hello, good evening, doctor.
Good evening. You're welcome.
Yeah, thank you, sir. Okay, quick one. You said you don't understand the
So talk
question I asked.
to us.
So what I'm trying to ask is that I have someone who has been trying to conceive after she gave birth 9 years ago. So she has not been able to conceive since then. And then she said she has tried all her best. It's not going to. So it's not coming forth. So she was saying something like whenever she goes to the hospital, And then the gynae checked, they tried to check her to know what is happening. And then the doctor was like, oh, I can't see your cervix. Your cervix is nowhere to be found. So in that case, and then she said she opted for an IVF. And then when she got there, same thing before when they were trying to check, she was like, they said they needed to check uterus to see if there's any problem. That is where the baby will stay, and then they needed to check another. So, and by the time they were trying to check, and they said they couldn't find her cervix. So, and she was explaining that they said they wanted to do cervix dilation, something. Then she went again, still the same thing. And they asked if she's on her period. And she's always saying her period. So what could be the cause? I don't know, because I have even Googled for her to, you know, trying to know anything. I can't just figure out anything. So the question just, pop into my mind. I just said, let me ask.
Okay. Thank you for asking a strange question. But again, I would like to see the ultrasound report, right? If not anything, I would have even liked to scan her by myself to be able to prove what you're saying. She has a uterus.
Uh-huh.
She was her uterus. Maybe you guys are not even understanding what the doctor said. But anyway, delivery 9 years ago, was it vagina delivery or CS?
Yes.
Is she all right? So we are back. Hello, Mary. All right, Bello.
Yes, sir.
Did you hear anything I said?
The line
No.
was breaking, so I couldn't really hear you
Did you
properly.
hear?
Yeah, I can hear you now.
So I said, was she seeing her menstruation regularly?
Yes, of course.
So I asked all that to confirm if truly she has a cervix, right? Because cervix is the doorway in and out of the uterus. So if she doesn't have a cervix, there is no way she will be seen. She will not be. If there's no cervix, blood will not come out, basically, right? So that is why I would have preferred to scan her myself. I would have also preferred to see a scan result. No, it may not, Loisa, it may not necessarily be hysterectomy because, oh, well, maybe let's assume, we can assume that, but I
No, no,
doubt
no,
it
no. She didn't do anything like that.
because you cannot
Because
go for
I knew
CS.
I knew when she had the baby then 9 years ago, and she lost the baby, and since then she has been trying to
So,
conceive. And there was a time I actually saw she told me she did an what's it called, HSG. Yeah, she did. So I was wondering how come I was because I
so
asked
if
her
she
how
did
come the
HSG, where is the
sonographer
result
was
of
able
HSG?
to see your cervix, to go through, to check your tubes, and then you go to hospital. In fact, she even took the test results to the doctor and told her to go along with it. And then he was saying the doctor said they can't find her cervix and all that. And the doctor even asked if she's seen her period. She said yes, she's seen her period. So how come? In fact, I don't even know what to say. So the question just popped into
So
my
she,
mind. That's why I said,
Has she gone somewhere else to confirm these findings?
Yes, she also opted for an IVF, like I said. Same thing they said, but they can't say I've said it.
Calm down. No. Don't go to IVF yet.
Oh, okay.
Don't go to IVF yet.
Oh, okay. Okay, sir.
She went for an ultrasound scan.
Uh-huh.
They did not see her cervix. Did she go somewhere else
Not
that
ultrasound,
confirmed
doctor.
that they could not see her cervix?
No, not ultrasound. She did ultrasound. I think everything. They said the uterus is fine, cervix or something is fine, you know.
She has to go for
Yes.
ultrasound. That is the only way we can confirm that there is
But
no
since
cervix.
she was using a guy name, and then they said they needed to, check her, and they were looking for the service. They couldn't see it. I said I don't understand. Oh. I don't just understand.
And that is it's simple. It's simple. It's
Oh, is it
simple.
village people, sir?
Bello, calm down. Hmm? Calm down. It's simple. This live stream. That's number one. Number two, let her do an ultrasound scan,
Okay,
right?
sir.
She can do. She of course the sonographer will know what to do. But if I was to scan her, I will do a transabdominal first to look at it from here. Then I
Oh.
will now do the transvagina, right? So that we will understand. More likely, she has retroflex uterus. More likely, because the way retroflex uterus will bend, if somebody is trying to access it, you need to go a certain angle to be able to see the cervix. Is that okay? So
Yes, sir.
go to ultrasound first and confirm with images that cervix is there. But I can guarantee you it's a retroflex uterus she has. It's not a problem, it's just anatomical difference.
Is it
Right?
after birth?
Again,
Would this
there's
be
also the
possible
possibility
after few months
because
of giving birth? Then I don't understand.
calm down. I'm trying to explain to you.
All right, sir.
I told you to calm down before, so you need to really, really calm down.
Sir. Okay, sir.
You see, when it comes to some occurrences, anything is possible. Let me tell you a story. Are you ready for this story?
Oh, yes, sir. All right.
Just this year, I had the opportunity of running ultrasound scan for a certain woman. I did all the scan from early pregnancy up until when she was supposed to deliver. Right? The ultrasound image. Now, this is somebody who had done CS years ago, similar time like this one.
Okay.
So God has blessed her with this one now. So I did the scan. It was transverse presentation for her baby all through. Right? Now, when it was time to deliver, since it's transverse, of course, your doctor will opt straight for CS. Is that okay? Now, they went in. I was not there, I was told, but I did all the scan.
Okay.
They went in and they were confused. They could not understand what they were seeing. So right there, they started calling consultant. Hey, come, we'll see you. They put it on video call. Look at what we are seeing. This one here, he doesn't understand. They call another until they got to a consultant that was very experienced. Then he told them something. He said, if that lady has done CS before and you are confused, what you are seeing, what happened was that case then, her uterus was rotated. So they should rotate the uterus and the fetus in situ back to its right position. So when they did it, that transverse position I was seeing all through a scan became normal position.
Oh,
Do you understand?
yes, sir.
So do not think that nothing is possible, right?
Okay, sir.
Do not think that is possible. So calm down. The first thing I want to establish is through ultrasound scan, can we see the cervix? If the cervix is there, that helps us. Then I want to also know the anatomical variation. Is it a retroflex uterus? If it's a retroflex uterus, of course, it's possible that someone who is not meticulous enough will not be looking in the right direction to see, right? So these are the kind of things you want to do. Then we'll continue this discussion.
Okay.
Otherwise, we'll still be discussing mystery. There's no mystery.
Okay, sir.
Is that okay?
Yeah, fine, sir. So, sir, is that the reason why she has not been able to conceive or what?
You have not done the first one. You're asking another one. Bello, you don't come again. No.
So that I know she, so that I will know what to, doctor, I'm sorry, so that I will know what to tell her. That's why
Tell her. First thing first,
Uh-huh.
we need to know through ultrasound whether cervix is there. I want to see the image, right? Because somebody that is menstruating definitely has cervix,
Uh-huh.
right? Where is the blood passing through?
Ah,
So we want to see the cervix. We want to see the type of uterus she has. Then we can now suggest what the situation may be, or maybe she may need to go and see another gynecologist or fertility clinic that can help. You understand?
yes, sir. Thank you so much, sir.
Abimbola, Dr. Ekunleo, you are welcome, Abimbola. So do that, and give me feedback. But if
All
you
right,
don't,
sir.
come back, well, bye bye.
I, I,
Right?
will- I will
But
definitely. I'll call her tomorrow and then I'll tell her to send the previous scan she did. Then I'll just send it to your inbox, sir.
all right, thank you.
All right, thank you, sir.
All right, who is this? The lady without picture. You are not following me. Amoa. I'm sure you are from Ghana. Amoa, are you there?
Yeah.
So why are you not following me? I want to be sure.
Oh, I'll do it. Don't worry. I'll follow you. Don't worry.
No, I worry. Why are you not following me?
I have done it. I'll follow you. Don't worry. Mhm.
All right, shoot. Let's hear you.
I want to
Hello, Mary.
conceive. Yes, I want to conceive. I've not taken any pills. I don't know the reason why it's happening.
What's your age bracket? 40, 30s, 20s? What bracket are you?
20s. 20s.
20s. You don't get problem
Yeah.
now. So what? For how long have you been trying?
No, for the past 4 months.
Huh?
For the past 4 months.
4 months. I sit down.
Yeah.
You don't have any problem. You can only say to have problem when now listen, oh, listen.
Yeah, I'm listening.
Mary,
Yes.
Mary, Mary.
Yes.
You know how many times I call you like this?
Baby, I'm listening to you.
You can only say
Mm-hmm.
to have issues. If you have been trying for 12 months,
Mm-hmm.
having regular intercourse at least 3 times a week, and you are, of course, in the same space with your husband, not that your husband is in Canada, you are in Australia. So if you meet all these criteria, you will be pregnant. But if your husband is in Burkina Faso and you are in Madagascar and you are telling me you want to conceive, I don't have solution for you.
But we are doing it already. Like we try. We
Do
try.
you know your
Okay.
fertile period?
Yes, please.
You know it.
Yes, please.
Good. Focus on your fertile period. Then
Okay.
cook better food. Cook better food that will boost sperm production. No go see whether pregnancy no go come. Pregnancy dey mad, e go come.
Okay. Thank you.
These things I just said in joke is very serious. Do it and you get the result.
Okay.
Go ahead.
Thank you.
Then come and give us the report. So what do you do? Let me before I let you go. What do you do?
Hairdressing. Hairdresser. I'm a hairdresser.
Okay, dresser. No, I mean I want to know
Yeah.
whether your kind of job is a stressful job.
I'm a hairdresser.
All right. Focus on your fertile period. Focus on your fertile
Okay.
period. You are the chairperson of your kitchen. So you have to cook all the food that is necessary for quality egg and quality sperm production. Do it
Okay.
and come and tell us the testimony.
Okay.
Right?
Thank
Go
you.
ahead and you'll be fine. All right. Who's coming up next? Before I go, I want to go now. And those of you that need supplement, better hold. Go to the viewer's eye. See, Pat Boye is there. She has enough supplement for you. Akuna. All right. If there's no more questions, Olami Posi, you asked a question earlier. Has it been answered? Has it been answered? The reason why I ask people to type to comment is because I want to be able to remember you, right? I remember her now because she was commenting in the comment section. So have I answered your question, Olami Pusi? I want to be sure if I have answered your question. She's not even following me, self. She doesn't like me that much. So have I answered your question? Ask for the kind of food to boost sperm. You have to subscribe to me in the green app or even here before I give you that. I've already done that before, but if I go back to it, it has to be. Which result? Adaya Yahwehnet. Really? Which result? So somebody can actually be a Yahweh? Really? That's wonderful. That's wonderful. Where are you from? Adaya. Where are you from? Just tell me where you're from. I'll relocate to that country. Those people must be very godly. Adaya, if you can hear me, I need your answer. Where are you from? Nigeria. He's from the main world. So, where did you get Yahweh net from? The feminized version of Yahweh. Really? She's from the main. She's not talking. But I'm interested. I'm really interested. You know, without God, there's nothing we can do. All these things we are teaching will not produce any results without God. So that's why, even though we exercise some level of knowledge, right? Until we send your request, please. Until we acknowledge that it is God that does these things, we may not get the kind of results we are looking for. You know, because of the way I talk, a lot of people think that I'm a very spiritual person. But if you do anyhow, I'll give you woto woto. Crystal label. Well, Yahweh net, she has gone. No, she has refused to come. She has disappeared. I don't know why. I am very interested in that person. I don't know why she disappeared. Yahweh net. Anyway, so tomorrow we'll continue from where we stopped today. Remember, we're on a journey to parenthood, and we are discussing everything fertility. All the details you need for a successful pregnancy, for a successful delivery, is what we are delivering. Right? That's what we are delivering. And we've discussed a lot of things before. We discussed a lot of things before some of you came. But there is still many more to come. That's why I'm telling TikTok, nothing should do this my account TikTok. Because thunder go fire una if una touch this account. How? Hold on.
Good evening,
Adaya,
sir.
hold on. Adaya, hold on. How? Is it how? Am I correct? Akua.
Yes, sir.
Good evening.
Hello, good evening.
You are welcome. So, talk to us.
Thank
What's
you.
going on?
Okay, so my problem is I had a myomectomy like 4 years ago,
Mm,
and since then for a while after the myomectomy, my menses didn't come for like 6 months, and then after six
mm-hmm,
months it started coming, but it's till
mm-hmm.
now it comes like a day, and it's not even like 2 spoons when I want to measure it. And
Okay.
I'm trying to conceive as well. So anytime
So,
I
do you have any kids already?
go to the hospital, it's like no yet.
What's your age bracket? 40, 30, 20s?
40.
Okay. For how long have you been trying to conceive?
Even before the myomectomy and after the myomectomy.
When was the myomectomy?
4 years ago.
Okay, have you done HSG?
Yes, I did. And it was
So
like,
what's what?
yeah. After I did, it was like one of the tubes were blocked. And there is this scan my doctor also recommended. I've forgotten the name. I do something something. I think the last one I even spoke to you about. I've written it somewhere. Unfortunately, it's not closer to me now. So when that thing was done, I was told it's patent. So meaning it's clear, right?
You said one of the tube is blocked, right? Is that
Yes,
not what
at
you
that
said?
when I did the yes, when I did the ECG, I think it was
Okay. Okay.
and so
Can I advise
okay.
you
Yes, sir.
so that you don't waste time, right?
Yes, Doc.
It's possible. It's possible to still conceive with one patent tube. It's possible. However, the chances are low. That's number one.
Okay.
Number two, the age bracket you belong to has further reduced the conception chances to less than 5% already. Do you understand? Why? Because of egg quality and egg quantity. You get?
Okay.
So I will advise you quickly to go for IVF. Also with the plan B of donor egg so that you don't waste your time. You can have your own baby. Make no mistakes about it. Maybe while you're even going for the IVF option, you conceive. You
Okay.
understand? Like the case of a certain individual I mentioned earlier. So, but you don't want to waste that time. Look at the chances. Look at the chances you have are all low right now. Whether it's age bracket, whether it's fallopian tube patency, you see the chances are low. So take the IVF option fast, right? But if the natural conception happens, glory be to God. If it doesn't
Okay.
happen, at least the IVF give you your result. Do you understand?
Okay. Okay.
So if you would take what I just told you seriously, I guarantee you by this time next year, we will not be talking about trying to conceive. You will now be asking me how often should you breastfeed your baby to stop crying.
Amen. Thank you. Okay, please, how do I get
Yeah,
in
right.
touch with you?
I'm always well, you can go to my DM. You can go to my DM, private
I'm in
consultations
Ghana.
in my DM. It doesn't matter. You can always be my green app. I have virtual consultations in my green app, and all you just need to do is to subscribe, and I'll send you the link to subscribe, and you're good. You can reach
Okay.
me anytime within the month of your subscription. You can reach me anytime.
Okay, sir.
Plus,
Okay, sir.
plus, you'll be in the TTC group where we give all the fundamental information that you need to do to increase your chances for whether it's IVF or natural conception. So there's so much going on in the background, but what we are doing here is just to help people generally, right? So whichever one you choose is fine. Here or there is still fine.
Okay. Thank you, sir. Mhm.
All right, so let's talk to Adea Yawenet.
Good evening, doctor.
Good evening. Your name is very
Highly
it's
spiritual.
actually, yeah, very it's spiritual, and it's always this
Yeah.
kind of name that calls you when you are not calling it, right? So how is it? I want to start with your name before we go to your
Mm,
question. How
okay,
is it
sir.
that there is a human being that bears God's name, Yahweh?
The
How is
creator
that
name.
possible?
Yeah, it's possible because you what you, as Igbo people say Chukwu, Kenechukwu, Uchechukwu. It's the same way with Yahweh. Yes. So I decided to answer the real name.
Wonderful.
Yeah, and when I got married, my husband was asking me. So that is it.
Yeah, that's wonderful. In the Jewish days, those
Yeah.
scribes that write scriptures, when they are transcribing scriptures, when they get to that
Mm-hmm.
name, they will go and bath, come back and continue and write it because in other words, they are not clean enough to write it. So they have to now go and bath first to
So
be clean.
you are right.
You know. But it's interesting. It's interesting. That's nice. So I will use it for one of my this your name. I'll carry and do password because I don't want to forget it.
All right, doctor.
All right. So talk to us. What's going on?
Yeah. There's this transvaginal scam. So at the month of October, I noticed I did not see my period. So I saw my period on October. So throughout November, nothing, and I was having these symptoms of pregnancy. So at a time as first week of December, I started having this severe pain as on my lower abdomen. So at the
Mm-hmm.
time I will go to ease myself, I will make use of toilet and I will see a blood, just a little of blood. So as the time goes on, the
Mm.
thing was so painful. So I have to call the doctor and they now send me to transvaginal scan. So when I
Mm-hmm.
done it, I now got the result. So he now say what he said. That was like, what he said, I'm not satisfied with it. Then I
So
said
what
that
did he
I need
say?
to ask. So he said that I having fibroid. I even have the result here. So and he said that the fibroid is in my womb, inside the womb.
Okay.
So I was like, ah. So then now started asking me if I'm having heavy flow. I said I never have anything like heavy flow before. That even this one that is coming out, that I don't really understand what is going on in me. And I'm trying
So
to
have you tested
conceive
for
for
pregnancy?
yes. No, I did not because after this I did not even bother to test.
So what did your ultrasound say apart from the fibroid?
I don't know if I can send it to you, the result.
You will pay now. If you go to my DM,
Okay.
anybody that do mistake enter my DM must pay money.
Okay.
But let me get clarity. Let's see how we can help you first. If it's not clear enough, then I can direct you to my DM. Because the money is not the
Okay,
problem.
okay.
It's
Let me tell
actually
my
the
husband to read. Okay, let me tell him to read it out for you. The result. Obi.
okay. Just go to the place where they write uterus and read that part.
Okay,
Okay. Doc,
okay.
good evening.
Good evening, sir. Good to see you.
Okay, good to see you too, sir.
All right.
Okay. It says uterus and an antivected and bulky uterus measuring 10.63 times 5.57 times 7.9 cm, 96 cm.
Mm-hmm.
The cavity harbors small clumps of amorphous echoes resembling retained blood clot.
Okay.
This has an estimated volume of 6.39 centimeter squared 3.
Okay.
Color Doppler study showed enhanced and endomyometrial vascularity
Mm-hmm.
with a PSV of 11.48 cm squared
Mm-hmm.
on spectral analysis.
Okay.
No fetal pole activity seen.
Mm-hmm.
Myometrial architecture is poorly homogeneous.
Mm-hmm.
Note: intramural myoma nodules of sizes
Okay.
3.41 times 2.88 cm, comma 1.24 times 0.94 cm,
Okay. Skip the
bracket
digits.
open, calcify,
Okay.
bracket closed. Then comma 1.42 times.
No, skip the digits. Skip the digits.
Okay, in the posterior wall. Note a subserious nodule of size 4.52 times in the anterior wall. In the anterior wall. Nodules show red degeneration. Then ovaries slash adnexa. So you said I should read only the uterus. That was what I
Yeah.
read
Yeah.
out.
Leave the rest. Leave the rest. Okay.
Okay.
So
Yes,
the area of interest. The area of interest is the area where you mentioned the endometrium. Is the area
Okay.
where you mentioned
Can I give you the
endometrium. Was
summary,
any?
doc?
Yeah. Okay. Yes. The summary. Give me.
The summary says small intracavitary blood clot.
Okay.
Incomplete. Then second, uterine leiomyomas.
Okay. Don't worry about those ones. Those ones. Their location is not my It's not a problem. Um.
Okay.
Um. Your last normal menstruation was when?
that was October 6th.
October 6th. This is December.
Yes. So, but after the severe pains at my lower abdomen, after
Mm.
I've gone to the scan and everything, so I started seeing a clot of blood. Whenever I use the toilet, I will see clots of blood coming out from me.
Mm.
But it's not like I'm really menstruating, as in I don't see the
No,
way I'm
I
normally.
get what you're saying. My concern is that more likely you are dealing with early pregnancy failure because of what you are explaining. More likely you are dealing with early pregnancy failure.
Okay.
However, however, the scanty volume of this thing that was read inside the endometrium there also can suggest
Mm,
um it can suggest implantation bleeding also. So what I want you to
Okay.
do is, when did you do this scan?
I did it on. Let me. I'm coming, sir. This is on on 12th of the 12th December. 12th December. Yes, ma'am.
What's today? Today is 17.
Today is 17th.
So what I would advise you to do, you may want to do a rescan, yes, but again, I also need to know through blood, the serum pregnancy test through the blood, right? I want to
Okay.
know whether pregnancy is positive or not.
Okay, sir.
So if that's the first thing you need to do, let's clear that. So if it's positive, then we are dealing with implantation bleeding. Then you
Okay.
need to go and
But
rescan
now,
2 weeks from now. But if it's
okay.
negative, then we are dealing with something altogether.
Okay. Okay. Because as of yesterday and today, I noticed blood stopped.
No, it doesn't matter. Don't worry about whether it's coming
Okay.
every day or
Okay.
not, because more likely
Okay.
implantation bleeding does not continue. It's just for a short time,
Okay.
and it's spotting. It's not as if it's rushing, right?
No. No.
So first, do blood PT. Let us know,
Okay.
is it positive or negative. If it is positive,
Okay, sir.
you are dealing with implantation bleeding. Then 2
Okay,
weeks
sir.
forward, go and do a rescan so that we can continue the
Okay.
follow-up from there. Is that okay?
Okay, sir. Okay, sir. I
If
will.
you if you do this, the clarity that you're looking for, you'll get it.
Okay, sir.
All right?
Pregnancy test.
Pregnancy test, then like 2 weeks.
Okay, sir. You said after 2 weeks I will do PTS scan.
I hope you got exactly the way I said it. I said do
Yes. Okay.
serum PT first.
Okay.
Okay,
If
so
it is positive,
Yes, sir.
in 2 weeks' time,
Mm.
go and do a follow-up scan. But if it is negative,
Okay.
then you're dealing with something else. Don't worry.
Okay, sir. All right. I will do that.
All right.
Thank you, sir.
You're
God
welcome.
bless you.
Thank you very much. You're welcome. All right. So who are we? Who is talking to us now? I guess it's time to go. All right. Thank you everybody for turning up. Thank you Adaya. Thank you Gold. Thank you all the wonderful 33 people in the viewers eye. Queen Josie Love, Pretty Gold, Akuna, Gold, and all the wonderful people. I cannot mention everybody's name. Thank you for joining. Tomorrow will continue, and just be sure that you are in for continuous learning. Some of the questions that you have in your heart that nobody's giving you answer, I will give it for you for free. But make sure when you come, ready to tap this screen, right? If you don't have any reason to tap the screen, just locate where my head is on the screen. Tap it until as if you want to break my coconut head to come aside, right? So that is the way we should do it. So that we give more people the opportunity to solve their problems, right? It costs money to get this kind of clarity, but work with me so that we can get everybody to have the children they are looking for. God bless you. Toss and turn, twist and sheet. The body they walk, no beat the sea. Breathing deep, dreams so sweet. Nighttime dance will keep you fit. Oh, oh, oh. That's all about rhythm of revival. So when you wake up, turn
walk, now God they call. Keep on moving, keep on strong. Nighttime dance, they carry you along. Afro dance song.
Good night. Thank you. Good night.
Oh. So when you wake up, tango, no vex at all. Now body they walk, now God they call. Keep on moving, keep on strong. Nighttime gas they carry you long. Afro dance all. Dance all. Afro dance all.
Doc, doc, sorry, because there's something I want to ask. Please, you said I should do the pregnancy test first, and if it's positive, I will now go and do the second scanning
In 2 weeks' time.
in 2 weeks' time. Okay.
Serum. Okay. Do you guys have, what about the serum PT scan then?
He did not mention serum.
Okay.
It's not a
Thank
PT
you,
scan.
doctor.
It's a blood test for pregnancy.
Yes. Okay.
Blood test for
Okay.
pregnancy.
Okay.
All right. Thank you,
sir.
doctor.
Tiny and
Thank
strong,
you. We appreciate.
a rhythm of love where miracles Wiggles on the screen, they smile and cry. A first hello before the lullaby. She finds out it's a girl, been waiting so long. He sees his son, says I gotta be strong. Sometimes it ain't the dream they plan, but they hold on tight, love close at hand. It's a joy and a storm, it's hope and it's pain.
Tears in the sunshine, love in the rain. Every sky's a story, and all souls are new.
I'm just the witness
In the
heartbeat blues. Some news breaks hearts like glass on stone. I see the fear, but I stand alone. I hold their silence, I bear their tears. Praying they find
peace through the years.
some come back smiling, some never do. Some I can't forget, some I pray for too. They say I help, but they help me see His words a blessing wrapped in mystery.
It's a joy and a storm.
It's hope and it's pain.
Good evening, Mr. Tabs. We are about to go, actually. In fact, we are already gone. For you are welcome, Mr. Tabs. Good to see you. Mixed breed. What do you mean? Come up. Come on, explain yourself. This is I'm rehearsing for work with artists. So the next work with artists like this, they go fear. I must hit like $40 for work with artists. Oh boy. Oh, is that so? Sorry about that. Sorry about that mixed breed, but don't worry. It's not a time to be discouraged. You can always try again. The pregnancy journey is a journey of positivity, right? And I tell you, if you've been here, if you've been listening to me, right? When you have miscarriage, it's not all miscarriages that is a bad thing. The human body has quality control system that checks whether every pregnancy carries the correct coding that will produce this you are seeing on my screen. Do you understand? So if the coding is not going to produce this, that's going to make you cry for a lifetime, the body will terminate it. So it's not all miscarriage that is bad. The body sometimes is just helping you, checkmating the irregularities. Is that okay? So face the next one with positivity, do all the right things, remove stress, eat well, and make sure you have a happy life. You will be pregnant. Simple as that. There's no miracle to being pregnant. It's simple biology. And everything I just said in simple words is the way to go. But if you want to spend money, you can always bring the money, and I would do the same thing, even less for money, right? But don't worry, the next one will come. Good evening, Chidima Iwuchuku. I see you. Lady B, why is your badge gray? It means that it has been long you drop a heart me. It has been long. You're welcome. I hope you are good anyway. Hope you are good. You're welcome. So those of you that follow me, if you don't want to get pregnant, stay far away from me, because if you listen to me too long enough, the leg will enter, because that is how it will roll. Because the blessings of God will locate you, and all your years of trying will manifest into pregnancy. To next year, people go born like mad, left, right, and center. So we will never stop teaching people what to do to get pregnant. We will never stop it. They say there is overpopulation. It's not true. There's no overpopulation. How can there be overpopulation when you never born your own? Does that make sense? Right? So, what would they born? The earth is very large. It will contain all of us. Yes, so, Silver, if you continue to listen, you know that thing that those of us that are Bible people, you know that thing that Jacob did? Jacob, anytime his flocks want to mate, when it's mating time, they want to mate, he will carry that stricken rod and put in their front, so that as they mate and they see the rod, they now give birth to kids that looks like the color on that rod. That's the same thing, that's the same principle. And I'm not saying it, I'm telling you the testimonies that has happened, right? So if you don't want to be pregnant, leave me alone. But if you want to be pregnant, just wait, let my ring light come on. Then you listen to me for 3 months plus. The belly no enter. We could see what will happen. Right? So, but it's my desire that everybody who is trying to conceive. Because the world will be a happier place. The world will be a happier place.
In the rain, every scan's a story. All souls are new. I'm just the witness in the heartbeat blue. Today I saw heaven. Today I saw loss. Some dreams took flight. Some dreams got crossed. Still I thank the stars, and I stand true to the silent songs of the heartbeat blues. And the heartbeat blues.
know they carry stethoscope, but I see hope with every scope.
Heartbeat like drum from the most high. Small belly joy, no be small guy. She look my eyes, she won't believe. I show one light way, make her relieve. Love they grow for where fear they hide. One scan, joy must open wide. I scan for love, I scan for dreams. I they watch joy burst through the screen. Some they cry, some they pray, but I they witness hope every day. I scan for love, no time for mouth. Heartbeat clear like music shout. Even silence wants to speak. A miracle I they see each week. Squeeze her hand, she hold breath. Then don't try, fight many tests. But today life they wink from screen. And the tears of joy they wash them clean.
No matter the gender, no matter name,
This tiny kid go change the game.
I see destiny before it walks.
A heart way beat before it talk. When
I
some
no see heartbeat move,
and then you go
no say love get groove.
pain and joy they play one tune. Every day I scan with his heart. So if you ever feel say no like that, just know say heartbeat fi clear the way. I scan for love and I see I'm true. One tiny beat and life renew.
All right, good night, everybody. So tomorrow, 7 p.m. Nigerian time, we are going to be having another discussion. Okay, I'll check out the Mr. Tabs. I'll check out the work with artists now because I'm going off the live stream now. I'll check it out. Then let's see what happens. Thank you very much. Good night, everybody. Thank you for joining. See you tomorrow, 7 p.m. Nigerian time. God bless.